I did want to give you an opportunity to speak about this paper that you worked on. I believe it was in July of this past year. Is that correct?
Oh, okay. Yes,
Your
yes,
sexual, it was published in Sexual Medicine Reviews, looking into
yes.
the sexual dysfunction of Muslim women around the world. I'm just curious what your findings were.
Yeah, I mean, it's interesting because I think in 2018, I did a paper just on the review of what are some of the sexual dysfunctions that Muslim women particularly experience. And the way I did that review was looking at different countries that are predominantly Muslim and seeing what their research is. And in the United States too, we just don't have a lot of it. We looked at all the things around vaginismus, unconsummated marriages, looking at, some cultures that have still are partake in female genital cutting, some issues around chastity and the hymen and hymenoplasties and stuff like that. So I talked about all that in that one paper, and then we wanted to look at factors that are really contributing to sexual pain in Muslim women. And we saw that, I mean, if I could summarize it in one word, I would say education, right? Like one of the big leading factors that we're not seeing, I think in general for most people when it comes to sex ed, but specifically in some of the countries that predominantly are Muslim in origin. And I want to say that, like, traditionally, and I did point this out in my paper, and I had great medical student Arlene Lambda that really led this paper, which I want to give her a shout out to, because we don't do much without our good medical students. So, but traditionally Islam was a very sex positive religion, and so when a lot of this used to be discussed, and this was like pre-colonialism, again, all these cultural and political factors that have influenced how we look at sex. Colonialism is big when it comes to a lot of religions because there are a lot of puritanical values that were brought in. And so it used to be like really traditional times, people would talk about it like, how do we pleasure women? Oh, you can divorce your husband if you don't have good orgasms. These kind of things were really prevalent.
Wow.
Really. And then it just shifted after colonialism, like so many things do. But I think that one of the big findings was that, from a medical community, we don't have education. United States, other countries, some clinicians are not comfortable speaking about sexual dysfunction. So there's that barrier. There's the patient barrier to understanding their anatomy. There's family involvement in a lot of these cultures. Families like really deep rooted in a lot of the cultures. So the shame around, sexual dysfunction, menstruation, all that stuff is so prevalent in some of the culture that, it just transmits into generations. And there's still this lack of communication and lack of education that continued. And this kind of snowballs into all the problems that we are experiencing. And so that's why I'm always shouting about it, because I think we have to educate everybody. We have to educate, people involved in medical care. We have to educate religious people, we have to, scholars, whatever, this has to be done so that we have to understand our own anatomy, which, most of us don't from a very early age understand it. And we have to name the right anatomic parts, right? Like this is something we don't do enough of when it comes to female anatomy.